In today's video, we're going to talk about a simple method that can help prevent injury. Now, most people just jump into their workouts or specific activity, and that's when stiffness, poor movement, and injury sneak in. Before I do jiu-jitsu, train, or even warm up, I take a few minutes to release the tension and prime my body. Through what that is, you might ask? No, it's not stretching, it's myofascial release. Another term you'll hear is MFR. Myofascial release can be done with many different types of tools. One of my favorite tools to use is a foam roller, a foam ball, or if you are in for some torture and have a high pain capacity, you can use a lacrosse ball. Now, this simple method promotes improvement in blood flow and helps you move more efficiently in activity. In this video, I'm going to show you exactly how I do it step by step. And you see the specific muscles we are targeting on screen so you know exactly where the work is happening. I'm excited to get into this video. If you haven't already liked, comment, or subscribed, please hit that button. Leave me some suggestions. If you have any questions, please feel free to put it in the comments. All feedback and all questions are welcome. Let's get into the video. We'll start with the glutes. The glutes is a major powerhouse for hip extension and stability. On screen, you can see the gluteus maximus, the gluteus medius right above it, and the smaller gluteus minimus underneath. I'm using a foam roller to slowly roll across the muscle belly. Start at the top near your hip bone and work your way toward the crease where your leg meets your torso. Feel free to use angles and different positions to get into the muscles. If you find a tight spot, pause and hold for 20 to 30 seconds while breathing deeply. Spend as much time as you need to feel relief. Next, we will hit the adductors, the muscles on the inside of your thigh. These include 5 parts: the adductor magnus, longus, brevis, gracilis, and pectinis. They are responsible for bringing your leg toward the midline of your body and playing a big role in hip stability, especially in lateral movements and change of direction. To target them, place the roller or ball along the inner thigh while lying face down, with your knee bent to about 90 degrees. Start close to the groin, but not on sensitive tissues, and slowly roll down toward just above the knee. Pause and breathe into any tight spots. Releasing the adductors can help improve hip mobility and reduce strain on the knees and lower back. Quads. On the anterior side, the quads take a lot of impact from running, squatting, jumping. Roll from the top near the hip flexors down toward just above the kneecap. I like to rotate slightly to hit the vastus lateralis on the outer thigh and the vastus medialis on the inner thigh. Performing slow, controlled movement here will help release deep tension. Calves. For the calves, we have the gastrocnemius, the larger visible muscle, and the soleus underneath. These muscles are key for ankle mobility and explosive movements. Start just below the knee and roll down toward the Achilles. Point and flex your foot in a dorsi and plantar flexion as you hold on to tender spots to get deeper into the tissues. Shoulder and scapula. For the shoulder and scapula area, we are focusing on the posterior delts, traps, and rhomboids, muscles that help stabilize your shoulder blades. I'm using a lacrosse ball on the floor here to target smaller areas. Roll slowly between your spine and shoulder blade, pausing when you hit trigger points. This is great for improving overhead mobility and posture and just getting rid of those tight knots. Next, we will target the TFL, or better known as tensor fasciae latae. This small muscle sits at the front of your hip and attaches into the IT band, influencing hip flexion, abduction, and internal rotation. It often gets overworked from running, squatting, and prolonged sitting, and when it's tight, it can pull on the IT band and cause hip or knee discomfort. To work it, grab a lacrosse ball and position it just below the front of your hip bone, slightly to the outside. Lie face down or at a slight angle toward the ball, letting your body weight sink in. Hold on tender spots for 20 to 30 seconds, breathing deeply, then slowly roll a few inches up and down. This helps release the tension in the TFL and can improve hip mobility while reducing strain on the knees. Finally, we'll target the spinal erectors and lower back area, one of the areas I often get tight at. These are muscles that run along your spine and keep you upright. Start at the mid-back and work down toward the top of your pelvis. Try to avoid rolling directly over your lower spine. Instead, focus on the muscle beside it. Keep your core engaged and move slowly. Last but not least, this will be a fine-tuned movement I call the 4-point plank, a regression where I'm on my knees. My focus right now is thoracic extension, intra-abdominal pressure, and making sure that I have good neutral spine alignment. So just like your regular plank, and you want to breathe with your diaphragm. So a good cue that helps me is I like to bring my navel in towards the back of my spine and try to breathe through my diaphragm. A good way to know if you're breathing through your diaphragm rather than your chest, notice where the lift occurs. If you feel your shoulders shrug and your chest come up, you're more than likely breathing through your chest. On the contrary, if you're breathing breathing through your diaphragm, all that should really expand is your rib cage and your diaphragm in the center of your body. And that's my quick full body MFR routine. As I said earlier, this is not limited to other variations. Do your research, tune into your body, and find the areas that you're struggling with. Remember, the goal isn't to push through the pain, but to breathe, slow down, and release tension so you can move better. If you found this helpful, hit the like button, subscribe, share it with someone who could use a little body maintenance before training or just everyday activity. See you in the next one.